A patient presenting a complaints of burning micturition, prostatitis, unable to pass the urine, or a clear-cut picture of urinary tract infection, where the patient suffers from low backache, fever, burning micturition, frequent desire to pass the urine, soreness filling in the entire body, lower abdominal pain while passing the urine, or the urine which contains pus cells or mild hematuria. Homeopathic medicines like Apis, Cantharis, Berberis, Sarsaparilla, Lycopodium, Solidago, Sabal, Pereira breva, all of these remedies covers these symptoms. Similarly, there is one remedy which is not so common remedy, but this remedy also covers all of this symptom, as this remedy has a special action seen over genitourinary system, and the remedy is Chimaphila Umbellata. But what are those key symptoms, those PQRS symptoms which differentiates this remedy from rest of the remedy, as all of the symptoms are similar? What are those symptoms which help you to distinguish Chimaphila with Cantharis, Chimaphila with Apis, and Chimaphila with Sabal or Pereira breva? But how to understand this remedy, though it acts on genitourinary system? What are those symptoms when a patient sitting in front of you narrating all of his complaints are the guiding symptoms for you for the selection of this remedy? For this, you have to watch this video till the end to understand in-depth knowledge of Chimaphila. Hello friends, this is Dr. Ritvi. Welcome to Homeopathy the Healing Power, and in this video we are going to study homeopathic remedy Chimaphila Umbellata. So if you are still watching the video and have not subscribed our channel till now, then subscribe the channel, press the bell icon and select option all so that you will be get notified whenever a new video is uploaded from Homeopathy the Healing Power. Friends, if you find this video helpful and if this video have helped you a little more in increasing your knowledge of homeopathic Medica, then give this video a like and share this video among homeopathic students and new practitioners. So let's get started. Chimaphila Umbellata, the plant which is commonly called it as Pipsissewa, which grows in all parts of United States, Europe and Asia. From ancient time, this plant is known to act well on kidneys. So, this remedy acts on genitourinary system, on lymphatic system, as well as the main action of this remedy is also seen on mesenteric glands and on female mammary glands. So, constitutionally, this remedy is suited to plethoric persons, especially to the plethoric woman. That means a woman with full of blood. Specially suited to plethoric women who often suffers from any type of urinary troubles or breast related diseases. These individuals are predisposed to disease conditions like prostatitis, recurrent UTI, that is recurrent urinary tract infection, or any type of glandular swellings. Well, talking about their temperament, these patients have irritable temperament. These patients are so much irritated with their constant urinary troubles. Chimaphila can cause symptoms related to acute or chronic UTI, acute or chronic urinary tract infection, prostatitis in males, and conditions like burning urination with very scanty output of urine, which is oftenly loaded with mucus, or some degree of hematuria is seen. So as this remedy has a great affection towards genitourinary system, so let's see the symptoms of genitourinary system first. In this condition, we see that the patient has a great urging to pass the urine. This is most commonly seen in both males and females. So whenever the patient passes the urine is of offensive nature, contains a ropey mucus, and sometimes bloody sediments are also seen. That is, sometimes hematuria is also seen. With this type of the urine, the patient suffers from severe burning sensation and scalding sensation during urination. Again, this is an important symptom of Chimaphila. Also, the most important keynote symptom which differentiates Chimaphila from rest of the medicine discussed earlier is that the patient has to strain a lot before passing urine. Here, the patient passes very scanty urine, that is, the output of urine is very low, but it is not a free flow. Here, the patient has to wait a lot and has to strain a lot before passing the urine. So, that means after straining a lot, then only the patient can pass small quantity of urine, which is followed by severe burning in urethra. Along with this type of urination, again one PQRS symptom is yet most important symptom of Chimaphila, and that is the patient cannot pass the urine easily. That means here the patient has to stand with feet wide apart and body inclined forward. This is a typical position where the patient stands and passes the urine. That means the patient is unable to pass the urine without standing with feet wide apart and body slightly inclined forward. That is, slightly bended forward. This is the most important PQRS symptom which differentiates Chimaphila from rest of the remedies. This position of the patient for the urination expresses how strong the patient is straining to pass that little quantity of urine. So that indicates that the patient also suffers from retention of urine. In most of the cases, especially seen in the males, it is seen that acute prostatitis also indicates Chimaphila, and this acute prostatitis may often lead to retention of urine. Here the patient suffers from typical sensation, and this sensation is again seen in both males and females. And the sensation is the patient feels as if a ball is present in the perineum. And this typical sensation is felt by the patient mostly when the patient sits down. Here the patient feels as if the ball is pressing against the perineum. Here the patient also suffers from pain felt in the kidney region, and this pain later induces a sensation of passing the urine. That means this pain causes a desire to pass the urine in the patient. Dropsical condition is also seen in Chimaphila. That is, edematous condition in the entire body is seen. This edematous condition is often related with kidney related diseases. In Chimaphila, dropsical condition is also seen with hepatic diseases. That means there is an involvement of liver diseases as well, with edematous condition seen in the patient. So this remedy also works great for those patients who are chronic alcoholics and now they are suffering from any kidney or liver related diseases with dropsical condition seen. As well as Chimaphila also works great for acute and chronic cystitis. In fact, this remedy acts well on bladder, and here it is typically indicated for any type of inflammatory condition seen in the bladder, and also this remedy increases the secretion of kidneys. So that means the scanty urination seen in the patient can be improved after giving Chimaphila to the patient. Chimaphila is also highly indicated remedy for tumors of mammary glands. It may be benign or malignant. So it is specially indicated for atrophy or hypertrophy of breast. In fact, Chimaphila is a well indicated remedy for those women with heavy breast and now they are suffering with any urinary troubles. So Chimaphila is a remedy which acts well for any cancerous tumor seen in the mammary glands or any simple benign tumors seen. As well as this remedy is indicated for any type of glandular enlargement. All the symptoms in Chimaphila gets aggravated in damp weather, from sitting on cold stones or cold pavements and on left side. Well, talking about the potency selection, generally the tinctures of this remedy are prescribed and sometimes the lower potencies are also prescribed. So friends, this is all about the important therapeutic remedy for kidney related diseases. Please leave all your feedbacks or any suggestion in the comment section given below. Like this video, share this video and subscribe the channel to meet again. Thank you for watching.